My name is Tiffany Wade, and I'm a nurse practitioner student at Auburn, and this is my 5-minute lecture on pneumonia. The objectives of this 5-minute lecture on pneumonia are the definition and overview, risk, 3 key questions to ask, the top 3 physical examination components, overview of the most common treatments with expected outcomes, 3-party teaching components, and age consideration. Pneumonia is infection of one or both lungs. It can be confined to a lobe, a segment of lobe, the interstitial tissue, or a villi or bronchi. It can cause mild to severe illness in people of all ages and can be caused by bacteria, virus, or fungi. Evaluation of pneumonia begins with clinical examination and chest x-ray. The gold standard for diagnosis of pneumonia is the presence of infiltrate on a chest x-ray. Some common signs and symptoms include cough, fever, dyspnea, fatigue, pleuritic chest pain, rhonchi, rales, crackles, increased tactile fremitus, dullness to percussion, and egophony. Some of the risk factors for pneumonia include patients with chronic diseases such as COPD, coronary artery disease, asthma, liver disease, diabetes. Also age extremes, so the very young and the very old, people who smoke cigarettes or have alcoholism, also being in the hospital greater than 2 days in the past 90 days, and patients who are immunosuppressed, steroid users, patients with HIV, or patients who have had recent chemotherapy. So 3 essential questions need to be asked during the workup for possible pneumonia. Does the patient have any of the following signs or symptoms? Fever, cough, difficulty breathing, shortness of breath, chest pain, or sputum production? Especially any of those with abnormal vitals, that's going to clue you in to get a chest x-ray so you can diagnose or rule out pneumonia. Does the patient have a major comorbidity or recent antibiotic use within 3 months? If so, then they're going to need to be prescribed different antibiotics. Also, has the patient traveled or went on vacation recently or had any contact with animals? If so, they could have been exposed to an atypical pathogen such as Legionella, which can be found in hot tubs, hotel showers, or on a cruise ship. They may need more diagnostic tests such as blood culture or a sputum gram stain and culture to detect those major pathogens. The 3 physical exam components that must be examined would be auscultation of lungs. Abnormal breath sounds would usually be heard, wheezing, crackles, rales, decreased breath sounds, or egophony, which are EDA changes. Also with percussion of lungs, you would hear dullness. And vital signs and level of consciousness, so tachypnea, tachycardia, pulse oximetry, blood pressure. Paying attention to the vital signs and the level of consciousness will actually help you decide whether the patient can be treated as outpatient or inpatient. And here are 2 scoring tools to help predict mortality for patients with community-acquired pneumonia and help the provider decide whether the patient should be treated as an outpatient or inpatient. So you have your curve 65 and your pneumonia severity index, also known as PSI. The most common treatment for community-acquired pneumonia is antibiotics, so outpatient, uncomplicated, meaning no comorbidity, no recent antibiotic use. You can use doxycycline or macrolide, such as azithromycin or clarithromycin. For an outpatient with comorbidity or recent antibiotic use, you can use Levaquin or Avalox or beta-lactam plus a macrolide. Treatment is for a minimum of 5 days. Some sources suggest anywhere from 5 to 10 days for certain antibiotics. And patients should show a good clinical response. They should feel better within 48 to 72 hours after the antibiotics are started. The 3-priority teaching components include patients should be told to expect clinical improvement in 48 to 72 hours after antibiotic initiation. So educate them on worsening symptoms and educate them on when they should start feeling better. Other management would include rest, hydration, and they can use over-the-counter fever reducers and or pain control such as ibuprofen and Tylenol. Risk factors and prevention, so good hand hygiene, smoking cessation if they smoke, and the flu and pneumococcal vaccines. Over to the side in the box I have the CDC recommendations for both pneumococcal vaccines. Also, vaccinations to help prevent pneumonia in children would include the Hib, measles, pertussis, and chickenpox vaccination according to the CDC. So for age consideration with pneumonia, keep in mind the most common pathogen in pneumonia worldwide is S. pneumoniae. Children and infants, typically children under 5, usually viral agents are the most common cause, but if you suspect bacterial, then amoxicillin would do. Any children over age 5 and young adults, Mycoplasma pneumonia is usually the most common cause, and adults with community-acquired pneumonia, usually it is bacteria, which will be the M. pneumoniae and the S. pneumoniae. And the last slide includes my references.